Hello and welcome to this latest episode of the Mind the Bleep podcast. My name's Sophie and today we're talking to Dr. Liz Crotton. She's a GP and one of the trustees at the Sick Doctors Trust. This is a charity which gives advice and signposts to resources for medical students, doctors and dentists who might be struggling with issues surrounding drugs and alcohol. She takes phone calls on their helpline, which is open 365 days of the year. So let's get into it. Hi Liz, thank you for coming on this podcast for Wellbeing for Mind the Bleep. Would you like to introduce yourself?
Yeah, sure. So hi everyone. My name's Liz. I'm a GP. I'm based in Birmingham. I'm one of the trustees of the Sick Doctors Trust, so that's the subject of the talk today.
Okay, so for anyone that doesn't know already, what is the Sick Doctors Trust and what kind of work do you guys do?
Right, okay, really good question. So the Sick Doctors Trust is a charity. Essentially, it's an independent charity. It's been going since 1996, and we basically help doctors, dentists, and medical students who are concerned about their use of alcohol or drugs. That's the sort of strapline that's taken from the website. So there's a website that you can also look at if you want to find out more info.
Yeah, and does that encompass any grade of doctor, or is it a specific subset?
It's pretty much anyone, really. I mean, we get phone calls from all sorts of, well, not just doctors actually, and dentists. The simple answer is yes. It's anyone really who feels that they might want to talk to us. We're not particularly. We will talk to anybody if we can help, and so typically we may have calls from doctors and dentists, but we also get calls from concerned family members. I've had calls from employers, and relatives, spouses, friends. Anybody really. So it's quite a wide remit.
Okay, that's interesting. You mentioned about employers and other family members. I didn't consider that. It'd be interesting to know, do the person that they're calling about, do they always know when someone's ringing about them, or is it all off topic?
Well, it's confidential in the sense that when somebody phones us, we are insured to do the work, but we don't actually take any notes, or we don't even know a name. We don't necessarily need to know a name or where they're calling from. So often the answer is no, and they're calling because they might be concerned about someone they're working with or someone they're employing. Actually, sometimes that's rare. It is usually family members. It's not the person themselves, and they might want some advice basically because they care and they want to do something to help, but they just may not know what to help. They know what to do to help, so they phone. So, yeah.
Okay, so you kind of give over the phone advice.
Yeah. We've got several bits of the charity actually. I mean, the kind of main bit I would say is the helpline, which is staffed by volunteers. So we're all volunteers. We're a kind of mixture of doctors and dentists, and some of us are in clinical practice, some of us are retired, and we staff that helpline 365 days a year on a kind of rota basis. And anybody can phone us, depending on, within that remit. So we don't provide clinical advice in the sense, it's not like a medical helpline. We are clinicians because we're not insured for that, but we're insured to provide sort of signposting advice, support, and the people staffing the helpline have all got some experience of addiction, and some guys really. It might be that we've had a personal problem and we've recovered from it. It might be that we've had experience of family members, close family members. So we're all kind of. I suppose the word nowadays is lived experience, isn't it? So that's what you get if you phone us. You get a as someone who's a clinician, I guess who understands the clinician's world, but also has that element of lived experience, so we can provide. I always like to think of it as providing hope.
Yeah.
Because actually phoning up a helpline like that is a scary thing to do, even a helpline where you don't need to know your name or where you're phoning from. And I think it's really important to kind of help, to say actually there is hope, you can get better. These are some of the things that we suggest. So that's kind of the remit. The other, I got very carried away with talking about the helpline, but the other remit is we do talks to medical students and in medical schools. We've got the website. I think some of our members help out with kind of educational material for certain modules on addiction. We do talk to the GMC as well, interestingly. So we've had discussions with GMC, helping them help their medical advisors. So people who are actually talking to doctors and assessing doctors with fitness to practice, they've come to us for advice to kind of help them. And kind of understand what might be going on, which I think is a very positive thing from the GMC. So that's kind of a mixture. We tend to kind of, if we can help, we also talk to the media as well.
Okay.
So we get a lot of requests, and if we can help, we will.
Yeah. With the GMC, I'm glad you mentioned it, because I was interested to know, I think perhaps a reason why some people don't always seek help for, problems such as drug and alcohol is maybe a fear from potential repercussions from, governing bodies like the GMC. Is that correct for me to say that, or is there a stigma?
Oh yeah. I mean, there's a big stigma, and it's one of these things. People are more open now about mental health, which is a good thing. But addiction is still very stigmatised, and people quite often feel it's very normal for them to feel very alone, and there's often a lot of shame, and the word GMC tends to put people's blood pressure up and kind of push their heart into kind of over 100, and people are frightened of that. Yeah. I mean, and the fear is often that if I tell someone about this, then they'll phone up to the regulator, and they'll kind of almost be, and there won't be this sort of, there won't be and it'll almost happen instantaneously, and that really isn't the case. And so, that there are certain ways that people can seek help now, and I'll go on to Practitioner Health, which is the other organisation which we should mention. And that they have sort of understandings with the regulator. So that's we'll mention that a bit later on, because it's really important that people know that it isn't immediately a kind of a phone call to the regulator.
Yeah.
Really, really important that people know that isn't the case.
Yeah. What do the GMC themselves provide any specific support for these kind of problems, like in conjunction with you guys?
Well, I mean, my understanding of the GMC, I'm still getting to grips with it, because another disclosure is I work with Practitioner Health. So that's I'm not here so much to talk about their processes, but the GMC have a regulatory process, function. So their role in this, from what I understand, is a kind of investigative type role about fitness to practice and patient safety. So that's their remit, but they are, I think, taking steps to try and understand, the stressors that the doctors are under, particularly things like regulation, fitness to practice, and addiction. And none of us are perfect, but they are, I think certainly. I've been a trustee for I've forgotten how long it is now. Is it a decade? It's probably just under a decade. I've certainly seen the GMC be a lot more supportive and kind of interested in how they approach these things. So that's been my experience. But it does strike fear into people.
Yeah. I was wondering if, based on because you reach out to dentists, doctors, and medical students, is there a particular demographic that you see popping up more than others, or is it a fairly even spread, would you say, amongst all the subgroups that you reach out to?
We have less dentists.
Okay.
I don't think I've ever taken a call from a dentist on the helpline, actually, yet.
Oh, really? Okay.
Some of our responders are dentists, which is interesting, and that's also what we see in practitioner health, we see less dentists. But that's not to say dentists don't have problems, so that's kind of an interesting one. Oh, it varies. I mean, I've had a few calls this week. I'm doing the helpline this week, and just to kind of give you a very sort of vague sort of idea, I've spoken to people probably in their 20s and people in their 60s this week. So it does vary, and so we see, I mean, really kind of massive sort of, I mean, the simple answer is a massive kind of variation. Really. We get all things. I mean, we're also getting, I suppose, people contacting us with more behavioural addictions as well. So.
Okay, like what kind of things?
Well, things like gambling, and some of the more process addictions. I mean, spending money, sometimes sex. That kind of thing. And although we don't have a remit to help with those, a lot of the kind of processes are quite similar to drugs and alcohol, so we will talk to people who contact us. We're not, we try and sort of make it very much kind of human to human type thing, really. So we have a whole range of things, really. And I think the confidentiality, I think the fact that people phone up and they don't have to say who they are, is really helpful for people, and also the fact that they'll speak to another doctor, because that's, or dentist or clinician, because there's a real need, I think, for doctors to kind of they want to speak to other doctors to understand. It's a bit like possibly being in the military or something. I've never been in the military, but there's something very important about actually speaking to someone who understands.
Yeah, that's kind of why I wanted to do this podcast by doctors for doctors or other healthcare staff, How many numbers would you say you get a day, a week of phone calls of people that are looking for help?
Oh, it varies. I mean, we can have a week where no one phones.
Okay.
And we can have a week where, I mean, I've had 3 calls so far today, which I'm on for the week. And a couple yesterday. It's quite a busy week this week, actually. Probably because it's New Year. So, I would say probably about 4 to 6 would be, doesn't sound like a lot, but they can be quite in-depth calls. I mean, what we do is try and kind of spend some time with people. I mean, it's really important actually that people know, just so that they kind of know how it works. We're all volunteers, so because we're working clinically as well, and a lot of us do, if you do phone us up, which is great, if we're working clinically, generally we may not answer the phone, so do leave a message, and we'll try and we'll endeavour to get back. It could be probably work with health numbers, so just we'll keep on trying, because if we don't answer, it's probably because we're stuck in out of hours or something, or seeing patients in surgery. So, yeah.
Are they quite long conversations that you have with these people? Or is it a quick, advice and signpost to the relevant organisation who can provide more support?
It depends, really. I mean, a lot of what people want is, sometimes, people don't have, it's not uncommon for people to phone us and have never told anyone. So, a lot of it will be about installing hope. Because this is a really, if you've never been there, it's really shameful, actually. And it's kind of, people sort of feel really alone quite often. They've got the thing about being a doctor, there's this whole thing about being a doctor and actually being, having a certain image and a certain, not image, it's maybe not the right word, but having a certain gravitas and having to behave in a certain way. And then you've got an addiction, and the two are really, they're almost like poles apart. And people feel really ashamed And shame is one of these things you don't want to talk about it, you want to hide. You certainly don't want to. And so to speak to someone who kind of can go, yeah, I was there, or, I had that problem, or you're not alone, you can get better, this is what we'd suggest. And we try not to provide clinical advice if we can. But sometimes there is a kind of crossover, but we would suggest, sources of help and support and kind of offer practical advice as to, where to go next, really. So it is. It depends. I mean, other people will phone up about family members, and they'll sort of say, what can I do to make X or Y, stop? And the honest answer is you can't. But there are some things that you can do to help yourself. If that other half is a doctor, or there's certain obligations that people have with the regulator, with working, so we can kind of provide advice there. I mean, it's quite a, no call is the same. They fall into themes.
Okay.
But no call is the same, and some people just kind of want a short thing, and some people, it takes a lot longer, which can be frustrating if you're working.
Yeah, no, I understand. Yeah, where do you normally direct these people? What kind of specific advice do you give them, or what directions do you usually point people in?
Well, in England and Scotland, we have Practitioner Health, which is an NHS-funded organisation, which has been going for 12 years, I think. I work for them, so I should know. And they are a mental health service for doctors and dentists and other health professionals, but they do have, some of their work is addiction. And over the years, they've got a lot of experience with treating health professionals, so there's many things that they can do. And people listening to this, it's really important to understand Practitioner Health has something called a memorandum of understanding with the regulators. And the memorandum, it's a big word. It's something I've never heard before I worked on. It's on the website, and you can actually have a look at it, the Practitioner Health website. But essentially what that says is that if you seek help and you follow the treatment plan, and obviously the problem is treated, then the regulator doesn't necessarily need to be informed.
Okay.
Which is a fantastic thing, really, because that's often what keeps people
stuck. Definitely. Yeah.
And you've got people trying to do their own detoxes, and you've got people trying to kind of buy stuff overseas and do all sorts of, kind of, I can't remember the name of the drug that people use to come off alcohol. The benzodiazepine. You've got people buying it from overseas and doing all that kind of thing, and doing their own DIY detoxes because they're so frightened of
making it known.
And actually, it can be done confidentially, professionally, safely. There needs to be a time off work because that basically keeps patients safe. But it can be done, and the outcomes are really good. I mean, doctors do quite well here. They tend to be, we're driven people. We tend to be very good at. We often turn our sort of compulsive tendencies into getting better, which is really useful. And so, that's the. I mean, the other place that we might signpost people, or we would signpost people, not might, would be the British Doctors and Dentists Group, which people can have a look at. So that is a network of groups, modelled, I would say, on the 12-step fellowship. Maybe that's fair to say. They meet in many major cities and online, and that's a fellowship of doctors and dentists, and who can provide support. Really, really useful. So you can contact people on the website there. Really recommend that. We might signpost we probably would signpost actually to AA and NA, Alcoholics Anonymous, Narcotics Anonymous, any of the 12-step groups really that might be appropriate. Sex for addicts. What are the other ones? There's one for everything really. Well, smart recovery is the other one. Quite a lot of doctors look at smart. Smart is a newer format, which kind of isn't quite the same as 12-step, because sometimes 12-step isn't a fit for everybody. So they would be the main ones. They would be the main ones, I think. Yeah.
And they all on like a self-referral basis, or do you?
Yeah. Practitioner health, you can self-refer. So you just kind of Google practitioner health, and there's a very comprehensive website, and there's a big button on the front of it that says, I think it says, click here to enter the service. So you have to self-refer and then fill in a form, and then someone will get in touch. And it's a streamlined process. I won't go too much into the practitioner health processes, just to say that it's well tried and tested.
Yeah. Do you think over the last few years, I think there's been a lot going on for not just doctors, but I suppose the general population with COVID and cost of living and lots of different problems that affect doctors as well as ordinary people. Do you think that has caused any changes in maybe the numbers you're seeing or the cases that you're seeing with Sick Doctors Trust?
Yeah, I'm sure it invariably has. I mean, mental health problems have increased. We've probably only seen the tip of the iceberg, I would think. Certainly the stress on doctors and mental professionals has increased. And it would make sense then that addiction problems would increase, because addiction really is, it's a spectrum. And I talk really, we can all go and look at the DSM guidance and stuff, but I suppose as someone kind of looking at it from a process point of view, it's a really reliable is not the right way, but it's a way of dealing with emotional pain. Gabor Mate, who's a Canadian physician who lectures and writes books on lots of topics as well as addiction, says he always says, don't ask why the addiction, he always says, ask why the pain. And using substances or behaviours is a predictable way of managing those feelings. So it's complex. There may well be some genetic things with it as well. Doesn't happen to everybody. I was looking at something on not the BMJ, the BBC, a bit different, yesterday, that said that addiction is different in men and women, which is kind of interesting. So it doesn't happen to everybody, and not everybody will do something addictively. And the kind of, how do you draw the line? There's a sort of academic way of doing it and diagnostic way of doing it, but also I kind of listen to how it affects people, sort of story and that. I think it will have got worse, sadly. But I think the message is really that there is sort of help available and people get better. And can actually, it can be a very, as difficult as it is, often with addiction, if you remove the substance or whatever and deal with what's underneath, it can be a very rewarding journey to go on. So it can be quite a blessing in disguise sometimes, having something like this. Yeah.
Have you got any nice anecdotes, maybe willing to share some success stories?
Oh, yeah. There's many. I'm just trying to think. There's lots of people who probably mind me talking about them. There's many, most of the people that I know, the doctors that I know, who have had problems are back in work, and they're working very successfully. I can think of anaesthetists, I can think of GPs, I can think of dentists, and most of those people would actually say that this was kind of a blessing in disguise, and they were kind of happy to they found it very, very painful, but very kind of rewarding journey, really, kind of unpicking it all. I mean, sadly, we do lose people. This is a serious thing. Some people don't get well, and it's not always clear what the reasons for that are. It can be a difficult journey, but it's a massively rewarding journey, and I think what I would say is that you're not alone. There's a lot of people who have been on this journey who perhaps don't shout about it, because there is still quite a lot of stigma, and it's probably not the thing you might necessarily tell your educational supervisor sort of routinely. I mean, you might, but you've always got that kind of risk of how they might react. But there's lots of sort of people out there who have kind of been there, done that, and many of us try and help other people as well in ways that we can. So that's kind of the vague way of saying it. I'm bound often by confidentiality and
that's fine.
Sort of naming people, but there's a lot of it about. I mean, there's a meeting with the doctors that meets kind of down in the capital, and it's huge.
Yeah.
Good laugh as well.
So I think kind of coming to the end now, but if anyone that is listening wants to access and get help from the Sick Doctors Trust, how do they do it?
So easiest thing is to phone us.
Okay.
It's an 0370 number, which is on the website. Just Google it.
I'll link it in the show notes and everything.
So that's probably the easiest thing. Just a caveat about the answer phone. Please just leave a message. We will get back. It's not that we're sort of... I told Google today that the business exists, so it's not just a business, but it definitely is alive and kicking. There is somebody available. You can email us. We do have an email. We don't check the email as often as the thing. You can get on the BGGG website and contact the National Secretary.
What's that, sorry?
He's on there. That's the British Doctors and Dentists group. So there's Richard and Mark who would be very happy to sort of link you in with a local meeting.
Mm-hmm.
And you can also self-refer to practitioner help as well.
Yeah.
If some people have questions about it, and look at the memorandum if you're not sure as well. That will give you confidence.
So, any closing words or general advice on people or well-being could be specifically related to drugs or alcohol, or just generally well-being for doctors and students?
I think gosh, it's such a big question. I think generally as doctors we're not very good at looking after ourselves. Sounds a bit negative, doesn't it? But we have to make it a priority because you can't, all that old adage, you can't pour from an empty cup. So the key is to kind of you can help your patients more if you look at your own needs, and that's not self-care is not selfish at all. And the other thing is kind of form relationships, strong relationships, have people that you can talk to, share stuff, and just, it's a great career. It's fantastic. It's a tremendous privilege. It's very difficult, I think, with the NHS, and we're all finding it difficult. But please do reach out if you think that there may be an issue, because there's a lot of hope.
Yeah, there are so many organisations out there, and I feel like they're not very well spread. So we need to tell everyone what there is, because there is so much help out there if you really want it.
No, well, Tea and Empathy is the other one. Tea and Empathy Facebook page. They have a secret group for addictions, so that's another thing I should say. They have a huge reach. So
yeah. All right. Well, thank you so much for talking to me today. I'll link all of the organisations and relevant phone numbers in the show notes. yeah, if anyone that's listening wants to send in any questions or advice, then can forward them on to you to answer everyone's burning queries.
We'll do our best. Yeah. But if we don't know the answer, we probably know somebody else.
That's right. All right. Well, thank you very much.
All right.
Thank you. Thanks. Bye. Thanks for listening to this episode of the podcast. We hope you found it useful, and for anyone who would like to contact the Sick Doctors Trust, then I will link their website in the show description. Please share this episode to your colleagues and anyone you think might need it. Look after yourselves and make sure you subscribe so you never miss any more episodes. Bye for now.